As we worked with different companies, organizations, so it was like, love to work together. How do we pay for this?
How did you get started in healthcare?
It was like, okay, do I go on to higher education and more debt, or do I go out in the world and make a difference?
What is the area of healthcare that interests you the most?
It's really chronic disease management, for the reason that so much of the progression of the disease is about...
Where do you see healthcare going in the future?
It's the intersection of a couple different things. The wearables that we talked about. Also sharing that data, not with just your healthcare professionals, but...
If you could change something about healthcare today, what would that be?
We're slowly making this change, but how do I incentivize the system to improve my overall...
Welcome to Healthcare Journeys, where we discover the stories of healthcare professionals driving innovation and impact. Our guest today is RJ Kedziora. He's the co-founder of Estenda Solutions, a company specializing in custom software development, data analysis, and AI for healthcare and medical companies. He's had a remarkable journey spanning over 30 years. His extensive experience enables him to provide valuable guidance and innovative insights, resulting in cost-effective solutions that improve patient outcomes. We are so honored to have this conversation with him today. RJ, thank you for joining us.
Thanks for having me. Looking forward to the conversation.
Yeah, very excited about learning about your background and your company today in healthcare. I mean, it's everything healthcare. So just let's get started. How did you get started in healthcare?
I started back in the 90s with the computer science degree and programming, and dodged and weaved my way through different industries and large corporations, small corporations, consulting product companies, kind of trying to figure out, where did I fit in the world? And early on,
where did you go to school?
I went to Duquesne University in Pittsburgh, got a computer science degree. And it was interesting because I really was like, I'm going to go on and get a PhD in AI. And it was, I was talking to somebody over the weekend and they're like, AI still existed in the 90s? I'm like, yes, it existed in the 90s. It's not a completely new thing.
Yeah.
But I got a job offer and it was like, okay, do I go on to higher education and more debt, or do I go out in the world and make a difference? And went out in the world and made a difference. I've built the accounting systems, the railroad car scheduling systems, inventory management systems, fascinating challenges over the years, kind of thing, to, get the right railroad car to the right place to pick up materials. But it just wasn't very interesting from my perspective. And I started into around the turn of the century in 2000, got into like pharmaceutical software development, consulting kind of thing. And that led me into healthcare. At the time, and still today, it's healthcare is very challenged with the digital transformation. Back in the early 2000s, data was really just becoming a thing in the world of healthcare. Healthcare has always embraced technology. You think of the MRIs and all the different things from a drug discovery perspective, but data, it was really healthcare was the last industry to really embrace data. In 2003, when we started Estenda with a good friend, Drew Lewis, we were fortunate. We had a part of a congressional grant with the Joslin Diabetes Center in Boston for the development of a disease management solution for military healthcare. So got to work with Walter Reed Army Medical Center, there's some VA facilities, the Indian Health Services, which is responsible for the American Indian population here in the U.S.
Go back a little bit. Did you have how did you get that started? Like, you have a connection? It was just like, it just happened?
It was that personal connection.
Okay.
Drew knew some people there, Drew and I were like looking for opportunities at the time to launch a venture. And that's really how we got started. You always hear those fortuitous circumstances that came together at the right moment, the right time, and it really worked out. In the first 10 years of Estenda's existence was very grant focused. So as we worked with different companies, organizations, healthcare systems, community health centers. So it was like, love to work together. How do we pay for this? We don't have any money.
Right.
And so we would go out and get grants from military healthcare. There's, extensive grant programs, or the National Institutes of Health.
Okay.
And then some private industry, the Robert Wood Johnson Foundation. Over the years, we've been able to get grant funding. And then the last 10 years now, it's still a mix of grant funded work and more what I think of as commercially focused work, where we work with life sciences, med tech companies, big like Fortune 50, as well as startup organizations. So for me, it's really about the challenge in being able to take on new, interesting problems and create solutions. And, I'm not a doctor. I don't play one on TV, but I get to work with a lot of doctors, nurses, healthcare professionals, PhDs, solving these challenges, helping improve patient health and wellness. So it just gives you that good feeling when you go to bed at night.
Right, for sure. I mean, I want to know exactly like how do you guys impacting patient care, but I want to go back a little bit to the moment where you become a co-founder, because I think you had you mentioned your journey from when you chose, instead of your PhD, you went into working in different industries, and there was a moment when you became a co-founder. So what happened? What was the trigger that you said, okay, let's get together? And sometimes those things happen. Like people say, like, I don't even remember how did we decide to do this? And we did it. And then all of a sudden, here we are with a company. But do you remember back then when you said, okay, let's partner?
Sitting in a bar in Boston one day, thing, and Drew came up with this idea and was like, let's go and do this. And I was like, oh, wow, okay. It came out of some frustration of what we saw. We were both part of another consulting organization prior to starting Estenda. In the early 2000s, the industry was on a downturn. The company we worked for went from a couple hundred people to maybe 100 people overnight, kind of thing. It was interesting. It was my first experience with layoffs at that point in time, because I was in, software and technology through the late 90s, where, it was the internet, you could do no wrong. And so then as it turned in the 2000s kind of thing, it got a lot harder and more interesting. And, at one point, the sales leader of the organization we're with got up on stage. I'll never forget this. He got up on stage and started explaining our sales strategy. And, 5 minutes in, he's like, oh, this is too complicated. Forget about it. And I was like, wait a minute. This is the sales strategy for our organization. So when we had the opportunity to go off and embrace and do things our way, we jumped into it. It was an interesting time in my life because I was also in an MBA program and having my second child. And
oh, wow.
My wife thought I was crazy, but she was on board, kind of thing. And we went off and did it. And here we are 21 odd years later. So.
Yeah, I feel like executives like yourself and founders like yourself, there's a moment in time when there are a lot of challenges that they take on that are very complex, like MBA, a new child, a new company, let's do it. And just one more thing doesn't feel like it's already crazy. Let's just do it. And that's when great things happen. So yeah, I mean, that's definitely a commonality that I've seen.
Yeah, I've been fortunate. My wife, Danielle, supports me in all these ventures. I did start a baking company along the way.
Oh, wow.
It was everybody's sort of second job. So, I was the baker. I came up with the recipes. It got a start, and we shut it down after a while. It really wasn't picking up steam. But my girls were young, 9 and 6 kind of thing. So they got to taste test everything and go out to the farmers markets and help sell, kind of thing. And we started a second startup in 2015 around some of the diabetes work we had been doing and remote patient monitoring, raised some independent funds for that. But the billing codes, which we were sort of banking everything on, really didn't get picked up enough. So we did shut that down in 2019. And Drew and I were like, well, what's been paying the bills all these years? So this is the consulting business, is helping others develop their products. I've mentioned, not being a doctor. So I'm not out there helping patients, myself kind of thing, but it's like the systems we're developing help others. So it's a force multiplier for us. It's like, okay.
You have the technical knowledge, which I think is crucial. I think in some cases, professionals that are dedicated to patient care are forced into technical roles because there's no other choice. And I think that's unfair. And also patient care suffers. We just had a conversation with someone who by training is a nurse, and she's now handling quality programs for a health plan. And she had to do a lot of technical data management, and she just needs someone like you. I don't think that she should be doing that and discharging people from the emergency room, which is also another thing she's doing. So definitely healthcare. I think one of the biggest pain points is data. Sharing the data, managing the data, making sure you're making the most out of your patient data too. So you've had a diabetes startup. You have Estenda, of course, as a co-founder. What is the area of healthcare that interests you the most? Like, I know as a consultant, but RJ, as you've touched a number of areas in healthcare. What's the area that you are most drawn to?
It's really chronic disease management, and for the reason that so much of the progression of the disease is about how you care for yourself as an individual. That's not obviously true 100%. There's lots of circumstances and different people have different situations. But, if I were to have diabetes, you don't get to see the doctor that often. So much about how you do as an individual is how you care for yourself. So how do we develop the tools and the technology to enable individuals, to take better care of themselves? And, there's somewhat of in the US here an accountability challenge of like, oh, let's let my doctor do it, or just I'll take the pill. But no, if you sleep better, eat better, move more, you're going to be better off. So that the idea of chronic disease management and how we can make an impact in that. There's a mental health crisis. There's an obesity crisis in America, and if not globally. So how do we develop those tools and technologies to help improve the health and wellness of those people? Which is why I love that particular space, because we can help drive behavior change, which is a very challenging issue.
How do you think, with your technical expertise, how do you think healthcare organizations can affect behavior in members or patients?
That's the $1 million question. And we're always trying different ideas and techniques. And I think first and foremost, it's meet the patient where they're at. So more and more people have the smartphone. So that's where you want to engage with them. And, it is unfortunate, but some people, who have challenges with just eating well and food and might live in a food desert where they can't eat well because of what's available to them, they still have their smartphone. It's become like an essential aspect of living today that you have your smartphone to stay connected.
Right.
So how do we use that to engage with the patient? There are so much learning in terms of marketing and sales. When you go to your supermarket, there's so much just data analytics driving that experience. How do we apply those in the world of healthcare? And there is some, over the years, hesitancy with going too far from that approach of impacting it and trying to drive those changes. Mm-hmm. But you walk into a supermarket and it's like, we know you turn right more than you turn left. And product placement at eye level is much better than product placement on higher or lower shelves, because odds are that's what you're going to buy. Those things, have been statistically validated over the years. So how do we use these ideas now in healthcare and helping drive behavior change? There absolutely is an element of you have to be willing and interested in driving that change. Part of it's education. Like years ago, it's 20 odd years now, I lost 50 pounds, through eating better and exercising. And I didn't necessarily feel bad, but I literally lost the weight of a small child. Yeah. And now, that was so eye-opening. Like, I feel so much better now.
Right, like you didn't feel that, oh, I need to lose the weight. Like, yeah.
But it made that difference. So sort of some of that educational component of what is possible kind of thing is powerful. I wore one of the new continuous glucose monitoring devices that are on market now for people without diabetes.
Oh.
And to see what happened with my blood glucose after a meal. And I know the science. We've developed these systems with various different companies over the years. And so I know after you eat, if you walk, your blood glucose won't go up as much. So to be able to run those experiments on myself was fascinating. Of like, okay, I eat a meal and then just sit and watch it go up and then come back down.
I love that.
Yeah. Wow. And then the next day, I ate the same meal, but then went for a 20-minute walk, and it doesn't go up as high, and it flattens that curve kind of thing. So it keeps my blood glucose in better control. I don't have diabetes. I'm fortunate from that perspective. But the same thing works for a person with diabetes. Very simple. You don't need to gym. You don't need equipment. Eat a meal and go for a walk. And
You've inspired me to get a monitor now. I don't know. I think it's great that people have nowadays the power to measure those things. I'm a firm believer in database analysis in behavior. It's not as easy to get data points, right? Like if you want to get your labs done on your own, it's not so easy to can I just get like a baseline? You have to go through a lot of hoops. But a monitor you can get. So I think it's a great.
And they're coming down in cost. They're easier. Like we've been, doing this for 20 years now. I used to wear heart rate monitors with multiple leads under my shirt to, find different contact points. And now I wear a ring, or, people can wear an Apple Watch and get all of that data, which is it's powerful to see that information.
It's interesting what you mentioned about the supermarket. I had someone on the show said something about if we were to apply the data points we have for advertising to healthcare, I think it would be very powerful, right? Because the advertising is extremely powerful. I mean, I say pink Thomas the Train or whatever, Thomas the Train, and I get ton of Thomas the Train everywhere. I'm like, okay, I didn't even search for this. I don't want it anymore. So for someone with diabetes or a chronic condition, there must be a way to influence their behavior that way. I mean, it's intrusive in a way, but it's also healthcare. So we're not talking about buying something.
It's the nudging. The word nudging is used a lot. How do you nudge and help people make better decisions in a positive direction? And I shared the anecdotal story of me just walking and doing that exercise. But there's an ad. It's like you don't need the exercise equipment or anything like that. Just go for a walk, and you're going to do better. Simple things make a difference.
So I have two more questions for you. Now that you have, now that I know you're not only develop software, but you like live it and want to experience it as well. If you could change something about healthcare today, what would that be?
I'd move us away from sick care as a system. So, I get sick, I go to the doctor, they get paid, to one of wellness. And we're slowly making this change, but how do I incentivize the system to improve my overall health on a day-to-day basis? Part of that I mentioned is that accountability. There's not a lot of accountability here. Just give me a pill and I'll be good. But I think that would make a huge difference in society and costs and expenses of the healthcare system if we moved and transitioned to that. Hey, make me healthier on a day-to-day basis, empower me to do that, hold me accountable to do that, and incentivize the healthcare systems to improve my health as opposed to just making me better when I'm sick.
Yeah, absolutely. I think that health plans are making an effort to also make healthcare more accessible to people, right? And that means more preventative programs, hopefully, like you say, focusing more on prevention than the sickness part of it, right? And my last question to you, you are, you consult with a lot of clients in the healthcare space in the different areas, developing technology, right? The software. Where do you see healthcare going in the future? You have a lot of experience with wearables and new technology. So where do you see all this going? Because blue sky.
It is blue sky. It's the intersection of a couple different things. The wearables that we talked about, remote home monitoring to better understand such that you can get externally outside of the four walls of the office, understand what's going on. But it's also sharing that data, not with just your healthcare professionals, but your caregivers, aging in place, which is where this comes together. The population here is getting older, getting sicker. My parents are in their 80s, fortunate they're doing pretty good, but they don't want to go into an assisted living facility. Like, let them stay at home. Right. So how do we apply the tools, the technology we have to understand, hey, my mother got up today. She got out of bed. She turned on the coffee pot. She's sitting in her favorite chair. She's watching Good Morning America or whatever.
How do you know this? You have cameras in your parents' house?
Well, that's the beauty of it. You don't need cameras. You can put a sensor under the mattress to know.
Okay. Have you put that sensor in your parents' house?
So it's less than, the camera's pretty invasive. So you don't want to do that. But the third part of this is then using the AI to monitor that and understand the patterns and trends such that when it diverges, it's then signaled, like, pick up the phone, check in on mom. She's doing good. In the AI, that's what it's good at, particularly now the Gen AI that everybody wants to talk about. I have a lot of conversations around that. It helps meet the patient where they are, the individual where they are. God forbid you get diagnosed with cancer today, you're going to have tons of questions. I use the analogy, my sister is studying quantum mechanics at MIT. I don't understand at all what she talks about. But then I can go to ChatGPT and be like, hey, can you explain this to me like I'm at kindergarten? And it does. It creates the analogies and ways to help me better understand it. So we can use the same technology and do that in healthcare.
And do that in healthcare. It's amazing. I try. For example, I turn on location sharing in my mother-in-law's phone. But then behavior, like, oh, she's still at home. And, oh, no, you were not home. Where's your cell phone? I left it at home.
Yeah.
So you went into a hike in the middle of the desert without your phone. Okay, great. Well, it's been great. It's been a great conversation. I think, we could be talking a couple hours about digital health, but of course, we have limited time. Hopefully, we can have another conversation with you just to talk about digital health. And the results, if you continue to use devices, what devices are those, and you can share with us. Anything you'd like to add?
I reach out, love to, Estenda.com, love to, have conversations, no commitment, just, explore ideas. I love talking to startup organizations. If we work with the bigger companies, it's usually like an R&D group. Kind of thing. But yeah, just love having the conversation, sharing knowledge, and how can we improve the world?
Yeah, thank you for that. Yeah, I'm a firm believer that just connecting with other people, just having conversations lead to partnerships, new ideas. You never know what it can lead you to. Thank you so much, RJ, for being here today.
Thank you for having me. I had a pleasure.
Thank you. Just follow S2M Health on LinkedIn for more episodes just like this. Thank you so much for watching. Until next time.